last time we explained Botox, okay? So let us now I tell you the zones. First, this zone. And this zone. And this zone. Always 100%. The most important before you start Botox, normally a lot of people ask about this. This is the line that really disturb people, more than this one. So normally people come always, like I can say 50%, who don't know any experience about Botox. Always ask about this only. So they please tell you, I need only this zone. This you should refuse 100%. You should do this zone, you can do it alone, okay. This zone together, this is together one zone. Alone, okay. This and this, like these two zones alone, okay. Without this, okay. But whatever you put here, even if you make baby Botox small touch, you need to make this zones. That the eyebrow go up, not go down. If you make it alone, the patient look tired and look very angry. Okay. So this is eyebrow. Okay. And this is the crow's feet. You know why is it called crow's feet? So because the feet بس صحيني ما يبقى لين
الساعة 7:30
مش ساعة، لا صحيني ساعة قبل الميعاد مستنيك بس. ماشي. سيب غلط. Okay. So how we make, like when you start from all this zone, what is the most painful zone? This zone. What is the most easy zone, like the client don't feel this zone? This, like normally the clients always when they come, you know, they have so much stress, we are afraid from, and normally you need, like a lot of people think I will start from the difficult point first, and then I will go for the easy, like I finish the most painful part first. No, you should never do this. You should always make the most painful part the last one. Okay, because the patient is now in too much stress. If you give the patient suddenly strong pain, they will get shock sometimes. But normally when they are so thinking, like waiting for the first injection, how it will be painful, and then you start from this zone, it's not painful at all. Then you will relax, calm down, like feel already, even when you make it stronger and stronger, they will already with you. But direct, if you go from this unit points, no, they will really maybe will not continue the treatment. I mean, they will okay, and maybe they will finish Botox with you, and they will not agree for lips, they will not agree for other things. This you don't want. You need the patient with you to continue the procedure. So always we start with this zone.
You always start with this zone?
Yes, always. Yes, I always start with this zone. Only if the patient wants only this zone. What can I do? So always I start from like normally this is eyebrow, okay? You make, for you imagine a circle like here. You start one in the middle, one up, one here. 3 zones. As a beginning, you can do only this. Don't always try not to I don't know the name in English, like, you know, you feel sometimes you need some small touch, small extra touch to make, no, never do this. Always make the basic in the beginning, and always you will have a good work.
Okay.
Like normally, I do here, and I keep small points here, like this is eyebrow, like as the last part here, you know, this way. Under, direct the eyebrow, direct you, the middle, like almost in the lower part of the eyebrow.
And how far from the eye here? Like, I mean, where for, like...
This is the eye, yes?
Here, or here, or...
Here, you know, you see this? There is, you see this part. Not
this.
here, not here. You
You
see, you know exactly with the eyebrow. This line already with the eyebrow.
There is the
Exactly.
muscles, like
Exactly, the outer part of the muscle, and it's exactly if you continue the circle with the eyebrow like this. Okay, not go, try not to go down here also so much because this affects the smile. But anyway, you make circle like this, like this. This is the line you will go with here, here, here. Some extra point, maybe you go both here under the lower third of the eyebrow here, and you know this is the eye. This is the eyelid. Do you know exactly direct under this outer lower part of this eyelid from here inside? Is it dangerous? No, it's not dangerous at all. By the way, all the muscle around the eye, the job is to close the eye. When you inject it, any point is to open the eye. Okay? So
it's
you
not
start.
dangerous around
No,
the eyes.
never dangerous. The only dangerous thing for the eyes, you know where? Or anything around the eye here is not dangerous for the eye. Do you know what is the most dangerous point for the eye? Here and with fillers and here. Fillers or booster for sure, because booster is also hyaluronic acid. Here. Why here and the tip of the nose? Because this is arteries connected to the cornea. But don't worry so much. Like if I see this, I can tell you later. I will tell you when I explain the fillers what you should know. And there is something, by the way, with your next tube all the time. Once you feel this, you put it direct and finish. It's not dangerous thing as you think, as you imagine. By the way, it's happened around the world only one time. One time. All these years. You know, so something very, very rare. Okay, but with whom? With someone stupid, like I hear the story from this lady, that she was complaining and she keep injecting, you know, like this is a stupid thing. If she would stop it, everything would be much better. Even she can.
And where this happened?
In England.
Not USA.
Hmm?
Not USA.
I don't know. It's like it was English, maybe. It's, you know. Okay, so we start with this one. Start direct with in the middle. Also, you continue this line. You start in the middle one. You go one down, one up.
Okay.
And the upper one is the outer part of the eyelid. Normally, some girls they have eyebrow like this up. You don't do this. You don't go inject here. You know, you care about the natural position of the eyebrow.
Okay.
Really, I find some girls that their eyebrow like this already they make it.
So there, no, not under this eyebrow.
Yes, exactly. You go with the bone itself. Care about the bone.
Okay.
Okay. After you finish this, normally, honestly, they get calm now. They get calm. Okay. So I go for this one. This is the most painful one, but I go for it first. Okay. I don't go for this one. Why? Because this zone and this zone, I need first to be sure. Like this is by the way, if you need to make good Botox, this zones. This one, I always little. Okay. Because this is what people most of complain that the eyebrow go down because they freeze it so much. But anyway, I go here, and then in this zone, you know, if you this is eyebrow, you make it half, and from this eyebrow half. Where is the half of eyebrow? It is with your cornea. You know this cornea, this point in the middle, pupil. This is the middle eyebrow, by the way. When you look in the front, by the way, I don't ask the patient this now, and with time you will not need to ask the patient not to put lines or points or something like this. I never in my life put it. You know, from the beginning, from the first time I inject, I never put this point because I know where I put.
But a lot of doctors, they put the points. They first paint it and after they...
Yes, actually, when you stand with me, when I do it, I can tell you already, it is not how I can show that it's much better not to put the point. Why? Look, when you work, normally if you put point like this, always the clients, they have their first point, I mean, always the clients, they have their like friends with them, and they look. If I put point here, a lot of times I decided I will not put it in this point. I will put here or here. I will explain later why. Then if I put point and they put it, didn't put it,
Mm.
or if I put some points and when I see, the patient move, anyway, I decided not to put. It will not look good in front that like I missed something, but I didn't.
Mhm.
So first, I make it like this. I make in the middle point. So I have the center now. Here also I make in the center. Here I make in the center. Then
Mhm.
this is the middle. I make 1 point here.
Mhm.
The middle, 1 point here. I always make it like here and here.
Mhm.
And by the way, when you don't put the point, you see better. Like you can really miss the point also. You put the point and then you don't put it in it, and you put the point and you don't put the good dose. It's not about the point at all. And I am the one who put the point in the beginning like this. So I put the needle direct without the point. Why I need to put the points? You understand?
Mm.
And then I put use the needle. I am the one who makes the point already. Nobody come make for me the points. So I put in the middle. Then just one here, one here.
Mhm.
One here, one here. Like this is the middle, okay?
Mhm.
And this is the middle. Middle fiber. I put point here and then point here. And then I come not in this point of the eyebrow, not here.
Okay.
I make first here and here. And then here and here.
Mhm.
And then here and here. They tell you all the time this stupid thing what I hear. Stay 1 milli above the eyebrow. It's very wrong. It's wrong. You should be in like inside the eyebrow, not even inside, like almost inside the upper part here. Like they say, I don't know who says this, stupid says this, because when you do this up here 1 milli, you already in the another muscle. You're not in the muscle you inject in. It is this muscle exactly here,
Mhm.
under the eyebrow and this part, and the origin from here, by the way. So I inject yes here, not here. So according to the muscle, how strong it is anyway. This is eyebrow. So this is one, and I told you in the beginning, first one is here.
Mhm.
The most painful points in these 2 points. So when you start with this zone in the middle,
Mhm.
and by the way, like always, like you don't give them a chance. They are in pain, but I know, but like this, when somebody in pain from one point already, they don't feel much the other point. One, I make it fast to feel the pain one time.
So you start from here.
In the middle.
Yes.
Here
And
in
after?
the middle.
Yes, in the middle, I understand. And after?
Direct. I go
In the
here,
middle, in the
and here.
eyebrow, in the middle.
In the middle.
Also, yes.
Yes, in the middle.
And
then-
after here or here?
No, inside.
Inside.
This is the zone you are targeting now. This here
Yes,
and here.
yes.
So you put here. By the way, you don't have to
Yes.
mix. As I say, you can make it here,
Mhm.
then do here and here, then here and here, then here and here.
Okay.
It doesn't must be
Okay.
like.
Okay.
And then this zone. This zone, this is eyebrow. Okay.
I have a question.
Yes.
Can you make first one, or 3, or all two?
Hmm?
I mean, first here, and
Hmm.
can you make here, and here, or you must go here, this?
This
Doesn't matter.
Doesn't matter.
If you make
It doesn't
Doesn't
matter.
matter.
Doesn't matter at all.
Okay.
I just choose the. Normally, when you go to the center, it's somehow, for example, try. Let me one time when I make for Botox for you, I try from this point, like that. You don't have vein here now. I start now. Then I inject here. It will be shocking a little bit. But when you go here,
Mhm.
I see. Right. Like it's like normally I find it's like, do you know how from where I know? Do you know how I know this? When I do Botox for myself. It's not about like, I make Botox for myself, so I know how each point painful.
Mhm.
So with time, when I try to make it for myself, I make it like this.
Okay.
You understand?
Mm.
This is how I come to my mind.
It's not that someone told
No,
you to make it
No,
like
no,
this, it's by
no.
yourself.
It is this point do it what
Mm.
it started from here until here, not even here and here and like this.
Mm.
But when you do it like this, it is like you start be symmetrical little time. Like sometimes when you inject here and here, the patient in so much pain, like almost like then honestly I put only another 2. I don't continue the 3, and it will work also good, you know.
But maybe for the beginner it's better to paint the points. Why? Because to see the symmetric.
Okay.
To not put one here and one, for example,
Exactly.
here to see the symmetry.
Exactly. If it's make you do whatever will make you more comfortable and easy. Like, but I tell you something. You put the point. The client need it already. So you need to fix this. Like, you will not keep making this, you know, and it will not be enough. So anyway, I work while there is blood, so I need to finish it fast. So when I put point with the bleeding, it is like nothing, and you will remove it with dressing anyway. So I mean, it's okay if you make it comfortable, do it. Maybe even the clients will like it. That you do something that they see on the TV and the TikTok. It's okay also. I didn't say I'm not against it. I'm just don't like to waste the time. The patient already from waiting, the worst thing, but in all the treatment, the patient while they wait. When they waiting for the treatment, they are in stress, they are nervous, they are afraid, you know. But when they start, they are some kind of released. Once they have the first needle, as I told you. So from this part, this is the hairline. Okay. This is I told you also, this is the middle of this eyebrow from here, and here is very important. Also, it will be guide for you from up here. Why? This part here, you are free to freeze it as much as you want. I will tell you later also what is the doses. Like, by the way, there is no specific dose. If I have this patient, like they have the woman, the big muscle, they have big muscle, it's not 5 or 10, you need to make more. And if they have atrophied and you put the needle and it's very atrophied, you don't need to make 5, you make even 2, less. I tell you, it's like when the muscle atrophied, so it's small, so it has less receptors. Later you will know. By the way, don't worry, this all what I say, it is not big thing, it's very stupid little things that everybody can understand it, and when you start the work. Okay, so you make this line and you to be free here. How you do this? Normally, I tell you something. If you look to me, I finish this alone. Okay, then I put this, and after, you know, here in this zone, you will find me, make this. Take this line.
Already, if you are just making this global.
It is not guideline. I mean, it's not. You don't have to make this. I'm telling you my technique, how I do it, how I make that, how I feel the client is comfortable, and for me, it is like I make lines for me. Like, by the way, you don't need to put points. Do you know why? When you put the Botox, there is ball coming up here. This ball is a diet for you, by the way. Like normally, sometimes when I work and I put one injection here, and somebody call me and text me or speak with me with a video, then, and even there is no blood, how I know? I make my hand like this. I feel it. You know? I put on the front. So I always, with this line in the middle, what I did already, you will keep seeing it like balls like this here. It is guide for me. Now I make the forehead half. Then after I finish this, like I say, when I go to this zone, I make the middle and go up, continue. It's like I make in half. Then I continue this zone, then I continue this zone from here.
If you make all 3, you mean you make also this. But if you make just 2,
exactly,
you will not put here.
Yes.
Okay.
Yes. But you know, you work with the client satisfaction. You are not treating pain. You know, you are not treating disease. So I was going even with some. By the way, when the clients ask me for this, I also put 2 points here. You know why? To make them happy. You know, like, because this is obvious. They will not notice, by the way, how Botox work good here. Always everybody don't notice how the Botox is good here. They notice here. Some people are very stupid. Normally, if you have problem with this muscle, so you have here also. But they need, because I don't know, they need to save the money. I don't know what is in their mind. So I make it, and I make it from touch also for me, like this. That to make them happy, because it will work here, even I make here, but they will somehow be happy. So it is then be symmetrical like this, like one, like this. It doesn't matter.
3 rows.
3, 4, 2 only, whatever. I tell you something. According to how the eyebrow I need to lift. Sometimes I don't need I need really to lift because the girl is made like this, and this eyebrow don't have so much. So I put already like one, and one in the middle here. So it's only 2. And in this area and this area, you will see on all TikTok, they ask you to make this triangle like this, and inject here. Everybody says this. This is totally wrong. This part will relax the muscle here, as I told you before, and this part will contract on itself to make the eyebrow look surprised. And you have another line here. This is a very ugly line, by the way. So I make the opposite, because this is one muscle. So I make here, and I leave this part. This part contract and left eyebrow good. How much, by the way, is this? Like, why I make this line? Because you are free to do any zone. Because like whatever it go down, it will not affect you. The eyes look really tired, and the eyebrow go down when this part go down here. But whatever, if you even when you make so much Botox here and this go up, even the eye look more beautiful even. I think it's like fox eyes when this one is there. So I put only 1 point here and 1 point here. How much? The lowest I can. The lowest points I can. Okay. And plus after I finish this, there is in the last line, this line lines. I put also the lowest, like the same like this amount, I make it here. Here I go the end like this. I go the end like this. Like this. What happens if you inject, when you inject, by the way, it happens 1000 times. When you go with the needle, you will find the needle hit on the bone. It's nothing. Just to go out a little bit. Don't inject, I mean, on the bone. It's not something dangerous, but it will be very big. So after this, we finish this one. Okay? I will explain later on patient.
It's too many points. I don't remember already.
No problem. You will watch
What if I hit some point and the person will be paralyzed?
In what?
What if I hit some point and the person will be paralyzed?
Paralyzed from where?
I don't know, something will fall down totally.
Nothing.
One like this, one like this.
Nothing. It will never happen if you like it will not happen. No. It will never happen. Follow me and it will never happen. Never. I have a case last week from Germany. She make it in Germany, and she showed me picture. It was very strange, really. One very down and one very up, like what is like yes, I saw it in a movie. It was very strange. And she told me, and she was worried to make it, but she was with the clients, and she asked her, and she told her it's so good, blah blah blah, and she because she wanted to make it, so she tried. It happened sometimes when you don't understand this. By the way, some people have autonomic asymmetry. Some part of the muscle side, like you know why? Some people like me, I smile most was one side. When some people lift the eyebrow, but I have Botox now. Lift the eyebrow more. This is autonomic. Sympathetic system stronger on one side. Then when you just make this stupid triangle here and here, for sure it will happen. But when you do it done direct here, it will not happen. But anyway, like normally, when it happen one up, one down, and it's happen, yes, I saw it. It was like, so what you do? You make the opposite. Like for example, you go for the one what is higher, inject more over it, and the one what is down to inject it under it. Like this one up and this now like this. What I do, I come here and inject here, put it down a little bit, and I come here, inject down and to put it up like this. Okay? So after this, we go for the lower part, the lip, because it's like very simple. This is the vermilion. Vermilion, it is the line between the mucosa of the lip. This line is called vermilion. Why we make Botox in the lips? For smokers' light, and also to flip the lips and relax it. Anyway, how we do it? We go for this, like this is the cupid bow. Okay, the needle should be under the skin direct. You know, this is the needle here. This is the tip of the needle. Before I go, I mark the tip, the cupid bow like this. That the needle maximum, and then I go back a little bit, and go from here and go like this. Then I will be here. Then I inject. Where? Exactly in the line. So, like, if for sure our hands sometimes make like this. Everybody, even if you are afraid, whatever. So what is much better, to put it above the line or under the line? Like if we say 1 milli, 0.1 up or 0.1 down. What is better? Down. Down the line. Because always imagine this. When you put Botox in any point here, put this in always in your mind. That it is like you put one like benzene or gas drop in water with soap. This will happen. So if you put Botox here, you should imagine that here and here go up, go like this. So if I put here, it will make like this. So this line will go up, and this is something I need. You know, if I put Botox here, I should imagine that this up, what above the Botox will go more up. So this is what I need. But if I put above the line here, so it will go down. I don't need all this. So it is in the line or lower, less than the line, a little bit. So normally the Botox lip flip or the Botox for smoker's line, it's all the same. You put point here and point here, point here and put point here.
So one here.
Exactly. Exactly. Here down also. Sometimes we make it here and here. Okay. But by the way, sometimes when I do it here, the patient get scared because everybody knows it for them up, and when I do, they worry because first time in Egypt maybe they think I'm stupid or something and make something wrong. But you know, so I mean this will be enough for them because the patient who go for some place make the same shit for them, they believe this is the right thing. Okay, this is lips. If we imagine now this is smile lines. Smile lines, this line. By the way, it is line. Why? This is come from the muscles here, like attach it to the muscles here, which under this fat, go down here. So that's why the fat makes this. You know? So smile lines is different from this line. This line is because of this muscle. So always, by the way, you find whatever sometimes you feel it's one line, but no, it's never. It's only one line. But sometimes some people is connected to each other. So the treatment is different. With Botox, we never treat the smile lines. Never. We treat the Marion lines. The Marion lines, the line would always come from the angle of the mouth. So the smile lines from the angle here. Whatever it go, it's the line from here. But the line is called Marion line. The line would come from the angle of the mouth here. So always a lot of people will find like this line, and even the smile line is finished here. Sometimes continue at the end. But another small line maybe is very small. Like normally the smile line, like 99% of cases I find it finished here. And there is another line, the merit line, the marionette line. Come from. The marionette line I told you come because this muscle here, Vocalaris oris, there is a lot of muscle attached here, here is the chin. So this muscle, because we use it all the time here to push the food between the cheeks and the teeth, always get tense and hypertrophied. So sometimes we can treat the marionette lines with Botox, but not only with Botox, but Botox will give good result. But here never. Here will affect the smile. This is a smile line. You don't need to change it. But this is sad line. And too much is speaking and too much is stress line. So this, how you inject this line, how we need to treat this line, this marionette line.
So when someone have it here, you know already they speak too much. They have too much stress.
No, it's not they speak too much. When they have it so much earlier, then they have it so much stress. But you know, this is normally happening with everybody because everybody speak. But some people are calm. So So this, you look at me if I have the line or not.
You have all Botox, so you
So this is the jawline, okay? This is the line. You feel it by your hand, by the way. Always when you gotta have fat here. You feel the jawline always with your hand. And this is the minute line. How you treat the minute line? Like for example, you don't have to see line, by the way. By the way, you can see this jewel here. This jewel, this big part was everybody start to have. This part start to be big. Do you know why we have already the double chin and fat in this area? Because our body distributes the fat according to how each part, how it's active. I mean, like when girl or woman go to train their glutes a lot, they start to make fat even more on the glutes later. When people speak so much or have tension in the floor of the mouth, and this muscle are very active, like the teachers, for example, or some people, whatever, they start to make fat here, and here also there is muscle became tense. That's why they start to make fat. And also, you know the cheeks. Do you know what is the main reason of the cheeks that we lose the fat in? That volume, that this muscle the muscles under it also became weak. Why? Because we don't smile a lot. We only speak a lot, but we don't smile a lot. That's why, by the way, later I tell you that yoga is very good for our face, because it works on this. Botox is to restore the normal muscle function by releasing the tense muscle or hyperactive muscle, make it paralyzed and make it smaller. But yoga work on strengthens the muscle. So it's like this. What happened with our face? Like look, falling down, it is two things. Muscle became weak and muscle became strong. So Botox, how we can treat this? How? By making the muscle more strong, weaker. To be weaker than this muscle again like before. Then the face go up, for example, like this. But yoga work on the weak muscle to make it more strong. To also become more strong than this muscle to lift the face more. Like there is two sides how you can fix the muscle. You should understand what is your goal about Botox. We need to restore the normal muscle function. And really, yoga help. How I know this? From my clients who tell me, I make you. And I see them, yes. I can understand they cannot lie, like I can really like girls and women who use retinol and they are 55 and 60 and they look in the 30s, they really, yes, there is strong evidence about retinol and I find yes. So I even start to believe more with my clients over the year. Yes, I find who use retinol, they look younger. I find who make face yoga, really the face is much better and the muscle much better. Really. So
by the face you also know the personality.
Exactly. Yes.
How if they smile a lot.
If they smile.
If they speak a lot.
Exactly.
If they
are
make yoga, for example.
If they are devils, also. If they are nice, kind people.
You don't know.
I really can.
How you know if they are devils?
It's appear on the face. You can find the face. You can see it. You can see it in the eyes. You can see it in their mouth. You know, really, you will.
And where do you see it? How
Okay.
you see it if they are devils or angels?
When we work, I will tell you, and I look, and I will show you, and whatever they can use, whatever they smile to you, whatever they try to make themselves kind, you will see. Anyway, how to treat this line? Normally, as I said, this is a muscle. What the reason of this line? That these muscles all became hypertrophied. So I need to make it weak. When I make it weak, it became weaker than this. Like if I take line like this, there is muscles put the eye and like the same here, the eyebrow. There is muscle lift and there is muscle put down. The muscle lift eyebrow with time became weaker. So this take good out. The same here. I need to lift this angle and this part. So I inject here. How I inject? Like this. By the way, this you put the lowest dose. The same what you put in the lips. The same what you put in this point. You understand? Very, very little. The same what you put in the body lines. This is this little dose. Like for example, you put from the insulin needle like 3. What is this? What is the name? Not milli, because it's not milli.
Less than
Yeah, 0.1 for milli. so you put 0.3 or 0.2 even sometimes, because this part people when they, especially for the first time, like this, you make like this is the angle 1 2 3 4 5 6, a lot of small units over this line. There is no limited number, by the way, according to the jewels, how big the jewels is. The same here. Okay. Masita, I will tell it to you later. This is the jawline, okay? There is also Botox in the chin. Later I will tell you, because I normally the jawline always connected with double chin, with fat in this area. So, by the way, also it's your job to guide the patient what they can do. You know, you should explain, and then they will agree. If honestly they agree already to make Botox here, they would definitely agree to have Botox here. They will never have only one problem for this. They always do it. So they make here, and then this is the jawline. I go from here. This is the middle. I go like 1, 2, 3. But this I put a good dose. The same dose like here. By the way, this is the part where I put the maximum doses. So the same what I do, later I will tell you how much, because it's also different from patient to another. I make also line 1, 2, 3, and then this is the jawline, the bone. I come under it like 1, 2, 3, 1, 2, 3, or 1, 2, 3, 4, 5.
So you mean here?
But you never come here. This points from here and here. By the way, I go there, but I know how to do it, so I can go whatever there is. I can go under the skin.
But you mean jawline? It's here. You put it. You make it here, the jawline.
This is the jawline. This is the jawline. Okay. This we make here. I will not put 1, 2, 3, 4. I go to this line. Up just above the jawline bone. I mean, you feel the jawline with the bone, don't you? And under this is the bone. I go under the bone like this. Like this.
So this also with the jawline.
With the jawline, yes. The jawline, you should do this. I need to make the jawline appear. I need to stretch above and
So
draw it.
here.
Yes. So I make here and all this line. Okay, enough today?
I have a question.
Yes.
Why you put Botox to the
Chin. This is how to explain. There is 2 reasons. Normally, do you know this line? It comes because we use when we speak, but you don't see it now because I have Botox. Normally, people when we speak, this can work with them, with this lip. So when we inject here, it relaxes. So when all the time, by the way, moving a lot the chin, it makes you lose the volume from the chin. First. Second, you start to have this line here. You know this line, horizontal line? It's because of the muscle go up when you speak. And also when you, like for example, like for your friend Lucy, they have a lot of points here when they contract like this. So this superficial points, like orange skin, because of muscles. Also we inject small points. How to inject the chin, I will tell you in the next very soon, inshallah. Okay.